The Trump administration is launching a digital health tracker. Cindy?
Well, it's not just that. It's this whole new digital health ecosystem that they're launching. On Wednesday, they announced it. So actually, there was an executive order in May, and then they did a whole lot of consulting. Apparently, there were comments from like 14,000 people or something. Anyway, and companies. And so what they've assembled is 60 companies, tech companies, healthcare, insurers, hospital systems, and they're all coming together and basically going to modernize the American health system. So now, if you need to go to another doctor, they have to get your records faxed over from, your last doctor, or people who have big problems are wandering around, with big dossiers of all of their medical issues, and nobody kind of looks through it all or has a sense of the whole thing. So now all of that is going to be voluntary. You can opt in, but in your app, you can go to the doctor and everything's going to be there. They can have access. So what happened is all these companies have basically agreed to make all of their data shareable and on a similar platform. Actually, let's just hear, Trump will introduce it. Let's just hear a bit about it and we can talk more.
Thanks to this announcement, healthcare providers across the country will also finally be able to kill the clipboard. It's an expression that's used, capital, with a capital C, kill the clipboard. Instead of filling out the same tedious paperwork at every medical appointment, patients will simply be able to grant their doctors access to their records at the push of a button. Just a button and you're all set, and all the information the doctor needs will be immediately transmitted. The system will be entirely opt-in, and there will be no centralized government-run database, which everyone is always concerned about.
I recently got a text message from a friend whose wife has been suffering from a chronic illness for something like a decade, and they've been trying to figure out what it is. They've never been able to figure it out, and I just want to read this to you right off my phone. He said, I uploaded my wife's blood work into one of our leading AI engines on Friday. It essentially diagnosed her as having a rare genetic defect that causes bone marrow failure. It's caused every single thing that's happened to her. She has every single symptom. It started at exactly the same age of presentation. It's 10 people out of 1 million. There's absolutely no way this is not it. So wow, it's really an incredible example of what AI is already able to do just today, and we're just getting started. And this was one person putting his wife's data in one of our consumer AI apps, and he's already been able to get that diagnosis, and that's going to help them tremendously. The key here is the unlocking of the data, because the more data that AI has, the better it performs. And so, kudos to Dr. Oz and Secretary Kennedy for this pledge today. They were able to get 60 major companies across different sectors of the economy to agree to unlock their data so that AI can use it to drive better patient outcomes.
So this is going to work at the patient level and also for the doctor level, the administration level of all of your things. So basically the goal is to, like I said, bring it into the modern world. By the way, there was 1,400 comments, not 14,000 comments that they considered in their commenting period. But it's considered a major big deal and in the audience they had there were all of these different companies that have come together, all the big Google, Amazon, the big tech companies, and like I said, all the healthcare providers and stuff. And, it could radically change your experience going to the doctor.
So why were Google and Amazon there about this big data thing?
Because they want the data.
Yeah,
they're acting like it's very hard to get all these companies to agree to taking people's health records.
Yeah, so that's what I was getting at. I was like, wait a second, those are not health companies. Why are they there?
No, because they're providing the data part of it. I mean, like the tech. This is a tech initiative,
Amazon
right?
is.
So the question is, who else gets the data then? Because it's
supposed to be secure. The goal of the whole thing is to make it, secure, patient-centered. I can't remember the other thing that they said. And then you'll have access to a bunch of apps too. So you were at the beginning. You said like a health. I can't remember how you described it, but basically. It will help you with your own health management too. So especially if you have obesity or diabetes or any of these common things, you can also search for your health a plan that you want, just to make everything one stop, easy to find. And during that thing, Secretary Kennedy was talking about Indonesia's radically improved its health situation in the country because people have access to all these, it's not exactly the same system, but something like that, especially in terms of apps to help maintain or make better choices for your own health, et cetera, et cetera.
Cindy, can I cook here for a second?
Yeah.
I feel like you presented an excellent argument for why this is a good thing, and I agree with you. I agree that, especially the example that that man gave on in that clip, where by pulling.
James Sachs, by the way, is a head of Doge right now.
Oh, head of Doge. Okay, so that was a great example. The way you can pull all this data and have AI look for the similarities between other cases, and you can diagnose people and save lives. That's the positive. I'm reluctant to give my endorsement to this idea because the federal government is involved. Trump says that it's opt-in. There will never be a centralized database by the federal government. But I would like to remind you that when the federal income tax first began, they promised us it would just be for the super wealthy. It would never be for anyone else. You fast forward 100 years, I don't know what percentage, a fat percentage of my income is going to the federal government.
Roman's still mad about this.
I would like to just present 2 clips back to back, and people can make up their own mind. First clip is RFK Jr. talking about this was sort of like, I think talking about actually the same thing, because I think the tracker he's mentioning in this clip will tie in to the AI database that is being created. Can you roll clip number 1?
Diet, about their physical activity, about the way that they live their lives. We think that wearables are a key to the MAHA agenda, making America healthy again. And we are going to, my vision is that every American is wearing a wearable within 4 years.
Thank you, Mr. Secretary.
Okay, so that was RFK Jr. talking about how he envisions everyone wearing trackables. And hopefully they opt into the system where they, the trackables are tracking them, and then they're sending the data over, and the AI is looking at the data as well as your health history, and it's following you around. It's building this large profile on you. But Cindy, you need a company to build the infrastructure for that. And one company, just one example of many companies, is Palantir. Palantir was a company that, among other things, built a similar type of infrastructure in Europe to track different crime data in different countries, and it was able to be centralized for the use in intelligence services as well as local criminal law enforcement agencies in the different European countries. It was called Palantir Gotham Europa, and here's the CEO of Palantir sort of saying what they were able to do with that system.
Look, we built PG, which single-handedly stopped the rise of the far right in Europe.
All right, so he said that he was able to use that system to stop the rise of the far right. I looked into it, and I'm like, how did it stop the rise of the far right? Because from my understanding in other speeches he gave, is he claimed that the Palantir Gotham program stopped innumerable terrorist attacks. And by stopping the terrorist attacks, the Islamic terrorist attacks, that stopped the far right from being able to use those terrorist attacks to gain political power. And so, ergo, by implementing the system and stopping the terrorist attacks, by combining all this data across all of Europe and being able to sort it and analyze it, they were able to stop the far right. Bit of a stretch. Last point, I'll wrap it up. You're like, Roman, where are you going with this? Okay, if Trump implements this, you would never think Trump would do something like this. Let's say 20 years from now, the system is implemented. All of our data is being collected. All of our health data is in this one centralized system. It used to be opt-in, but now obviously everyone has to do it. Catherine, can you put on the last tear sheet, the one of all the articles? This is from Vice. Gym bros are more likely to be right-wing a-holes, science confirms. Getting fit is great, but it could turn you into a right-wing lunatic. And this is from the New York Times from just yesterday, why the right is obsessed with thinness. So couldn't you see a scenario where they're tracking everyone, there is a much more left-leaning government in power, and they're like, hey, we need to stamp down on the far right. How do we do that? Health data.
Make them fat? I mean, stop. I mean, this is trying to stop obesity, not promote it. That's the counter argument.
Cindy, what do you have to say to all that?
But the follow-up is, in every other country, to my understanding, like in Israel or in Canada, which you would know about, this is all done via the government. We're kind of doing this through the private sector. That's the difference here, right? And the whole goal is, the promise is that this is going to stay there.
I mean, I think the whole idea, principally, especially when Doge got involved, is that there's ridiculous inefficiencies in the system. They literally, you have to get your records faxed over. If you want to move from doctor to health provider, there's no tracking, but nobody has a big picture view on your whole health, right? And if you think about it in those terms, everything else is modernized and digitized and AI-atized these days. But the argument would be, okay, well, let's just keep all of our health stuff in the dark ages because it can be, mass data can be abused.
I would say.
Are we already past that?
I'd say a couple of sides on this. One, I can understand why it would be useful because, of course, you go to the doctor. Sometimes it's like you have an underlying health condition, the doctor misses it, and they kill you. A great example of this. It happens a lot.
I know, but don't say it like they kill you. Like, they're trying to help you. They just don't, they don't catch it.
They accidentally kill you. Okay, you feel better now? I have a friend who has a thing like this, right? He's allergic to one of the ingredients, one of the carrier fluids in vaccines. He goes to his doctor. The doctor's like, "Did you get this vaccine?" He's like, "No, I'm allergic to this. It'll kill me." And the doctor's like, "Oh yeah, you're right. I won't give that to you." He's like, "Well, have you gotten the other shots yet?" And he's like, "No, I'm allergic to it. It will kill me." And the doctor's like, "Oh, right." So, I mean, in cases like that where you have some underlying condition and maybe you switch doctors and you forget to tell them that, you're allergic to something or you have a pre-existing medical condition, I understand. But I would say a few other things. One, there's no such thing as a secure digital system. They get hacked. The government gets hacked all the time. OPM, the Office of Personnel Management, that has like these security clearances of government, got hacked by China. If they try to tell you it's secure, it's
Everything is digital these days, and none of it's
not.
secure. I mean, let's just
Well,
admit that.
you're saying stacks of papers. Those aren't digital.
And by the way, these medical records are already, for the most part, digital anyways.
Well, that's the thing, too.
So they're going to be hacked.
Hospitals do it. What I personally don't like is centralization. And especially if you have big tech involved, which is in the business, they're free services, and they're in the business of selling your data. The big thing I'm concerned about, though, is how other countries use these things for biometric surveillance. For example, social control, like Tiffany's. Tiffany, how does the CCP use your health code on your smartphone? How does the CCP use your health data like this?
Well, they have a lot. So basically the issue with a lot of China apps or China phones is they don't just have access to what you do on that app, they have access to everything, including your health information. So if you're looking up your doctor, you're talking to your doctor via text or whatever, they can see that. They can also track your movements. They have all these different abilities. So they can see if you're, hurrying somewhere, slower, more sluggish, so they can use different things with that. They can target you better.
That's any backdoor on any phone.
Yes,
it have to be a
but
health
it's like
app.
a much deeper level. So they can also see where you're going. So if they want to monitor you, they could, if you're going somewhere maybe you shouldn't be, they're like, aha, you're a spy. But when they do have all of that information, and not just for one person, but a lot of people, they can start predicting trends or creating trends and influencing different things. So they could be like, oh, let's introduce this drug to all of these people, and now they're dependent. There's a lot of different ways they can use it.
This reminds me of the beginning of the Patriot Act. That's great. I don't like terrorists. Fantastic. But look what it became. You know what I mean? That's kind of how I view this.
I guess my question to you, Cindy, is like, I do agree with this idea. I think it is a good idea. But why does the federal government have to be involved at all? Is it because it's like too big and nobody else could do it?
But I mean, that's the thing, that they got them to the table. Who else is going to be able to bring all those different actors to the table and figure this thing out? That's literally what they talk about. And it's, enacting the Maha agenda. So what are you going to do, contract it out to someone? I guess.
So let's be clear. Is this voluntary? Or is this like COVID vaccine voluntary?
No, it's voluntary, or that's how it's being presented. Like you said, in 5 years, it could be like, well, if you want to get insured or the good insurance rates, then obviously you want access to everything.
You see, that's a great point. The insurance rates, right? Because like, I can imagine then if you have this centralized database, let's say a young, healthy young buck like me, I should get a lower insurance rate. But let's say someone is not so healthy, maybe their BMI is getting up there, they would probably get a worse insurance rate. And I can easily imagine if the insurance companies start using this giant database, there will be articles showing how it's hurting people who are not healthy.
Let's be honest here. This is just like absolutely everything else in our world these days, right? Everything is getting AI, like I said, and digitized and all of that. Can we avoid it? Is it gonna not happen? Like, I'm not saying that's a reason to go for it. I'm just saying it's just where we're at.
This is my modern theory on life. Freedom and safety are on a sliding scale. And the more you have of one, the less you have of the other. And I don't like this one bit personally.
All right, moving on to a happier subject. Trump recently announced that he is putting severe pressure on 17 big pharmaceutical companies?
He sent, on Thursday, he sent letters to 17 CEOs of 17 pharma companies, basically saying, remember that executive order I passed that said you have to give most favored nation pricing for your drugs, i.e. the same drug that's $40 in Europe can't be $400 in America. And I was thinking about it, and I haven't seen too many reports of anything changing since he said that in May. So he sent these letters basically giving a 60-day deadline for these companies to produce their entire catalog of drugs at this most favored nation status, and promise that any future drugs that come on the market also has to be at this pricing. Now, of course, what this is going to require is that they go negotiate with Europe, and because if a drug is $40 here and $400 there, you can imagine everyone would be paying $200 instead of, that would be how it would work. So, but to note, last Trump administration, he tried to do something quite similar, and it got blocked by the courts on a technicality. It was that he didn't, there wasn't the proper commenting, input period wasn't observed. And then the clock ran out, the Biden administration came in and killed the thing. So this one, apparently, it may have a better shot because it's being set up differently. And key is that he's asking, hoping that they will voluntarily come and do this. Just like, the food companies, well, no, because they could still make the same money, actually, right, by equalizing. It's just about redistributing the burden.
If Europe and Canada go along with it.
Well, they could have no choice would be the question. But one sec, I was just saying the voluntary thing, just like the 40% of the food companies have voluntarily agreed to take synthetic dyes out of food, right? The artificial dyes.
Yeah, but it's also not going to raise the prices of food in Europe by 400%.
Yeah, well,
that was a question that I
they've been freeloading is the argument.
I mean, I on that point, I support this one. I think it's a fantastic
Oh, so you
idea.
like price control?
I was going to say, this sounds like a price control.
I'm confused. Where's the sliding scale of freedom and safety now?
Here's what I think. I think we're getting ripped off by Europe, is what I think. And so,
you want the government to come in and tell pharmaceutical companies that they don't get the money they need for R&D.
View, one of the few true roles the federal government's supposed to play is negotiating with foreign countries. The original basic role of the United States, the federal government, was to have basic, border security, wars, and diplomacy. The reason we moved from a confederacy to a republic was for that exact reason. We were getting ripped off by Europe.
How is this
I'll give you an
and this is
interesting
not
stat.
the government saying, pharmaceutical company, lower your price?
Well, this is the thing.
I feel like the other country is irrelevant. It really is the company that's dealing with this.
Medical companies are price gouging Americans, and they're basically giving discounts to all these European countries, so we're subsidizing their entire socialist medical
Oh, I know.
Right.
I know what's going on.
I'll give you an interesting stat on this. America is 5% of the world's population and account for 75% of the profits or income. Pharma profits are from Americans.
Yeah.
In the US.
But how is he?
We pay for it all.
But how is he intending to do this? By raising tariffs on those goods going out?
No.
Wait, you can't even do that.
No, what he's doing, he's using most favored nation status. So, but only of developed countries, not of third world countries. So basically, the lowest price these companies sell drugs to in Europe is the price they have to give to Americans.
So,
but that sounds like out-and-out price control. Is the executive
Yes.
of the country able to just do that on a whim?
Well, so here's what's going to happen. As Cindy was mentioning, they're going to go like this. You're going to watch. I mean, if for example, Spain is paying $20 for something and we're paying $1,000 for it, they'll have to give us $20. But what that means is going to upset the entire market. So Canada and all of Europe are going to have to pay a lot more, and we're going to pay less.
We're just going to try to kill their national health systems.
Basically,
just bankrupt them
This
all.
is a war against socialism.
Yeah.
I'm 100%
so
behind
part
it.
of the way that the federal government subsidizes the other countries is that the NIH, or the federal government, gives a lot of money to the pharma companies for drug development. If you look at the whole COVID thing, it was $20 billion for Warp Speed. Then they bought another $20 billion worth of the vaccine once they were producing it. All of that, and the government bought all the shots, right? So a lot of money. That's just the Warp Speed example, but a lot of money from NIH, goes into drug development. That's one lever that they have. Well, we'll just cut that off. Because what the goal would be is to pressure the pharmaceutical companies to go renegotiate with the European, Canadian buyers, i.e. the government in those places. Like, that's the pressure that Trump will need to exert. And he said, without specifying anything, that he's hoping they'll come voluntarily, but if they don't, we will deploy every tool in our arsenal to protect American families from continued abusive drug pricing practices. Unspecified arsenal.
There's a lot they could do, by the way.
All right, I know exactly what you're thinking. That was a great clip you just watched. Now, if you're watching on YouTube, make sure to follow and also check out either these videos or maybe they're on this side. I don't know which side they're on, but we set it up. So these are the videos that YouTube is suggesting to you as the best ones that you'll probably like the most. So check them out, this side,